Can everyone hear me? Okay, good morning, everyone. So I'm Aaron Tai, the Senior Manager of Jinrich. So it's our pleasure to have you here to join the webinar. Jinrich Taiwan offers on-site automated PCR for animal health management. So today we are going to start our webinar, and we have two speakers to share their excellent experience and the knowledge about controlling poultry disease in the farm. Okay, so now everyone, we're going to start our webinar. So before we start our webinar, we would like to introduce our today's agenda to you. So we will have three sections today in today's webinar. The first section is a PCR application in animal health management presented by Susan Chen. Susan Chen is our marketing. Susan Chen is the marketing manager from Jinrich. She is also a veterinarian and complete her master's at the Veterinary Medical Hospital of a National Chongqing University. And the section is Think Out of the Box in Poultry Health Management. It will be presented by Dr. Keat Fu. Dr. Fu is Avian's Senior Poultry Veterinary Technical Specialist. So it's our pleasure to invite Dr. Fu as a speaker for today's webinar. He is experienced and an expert in the poultry industry's health management, and he will give us a fresh idea about improving poultry healthy in the farm today. So we will have a Q&A time after the presentation. So if you have any questions, you can leave the message at the message board, and we will address the questions after our presentations. So now let's start our presentation today. So the first will come to Susan. So thank you.
Good evening, everyone. I'm Susan Chen, Marketing Manager from Jinrich. Today, I would like to introduce Jinrich and the products of our company. Before getting to the topic, let me introduce Jinrich. Jinrich Biotechnology Corporation is the headquarters in Taiwan. So, being an international company, we also established two subsidiaries, that is Jinrich USA and Jinradar in China. As our service and the products gradually become more diversified and the employees are up to 160 personnel in this year. Our main service are developing, manufacturing, and marketing products for applied nucleic acid detection technology. We offer pathogen detection platforms, including equipment and reagents, to multiple industries. Until now, Jinrich has built up the distributor network in more than 40 countries, which located in different continents. To guarantee the standards in product safety and quality, Jinrich complies with Quality Management System ISO 13485, and our factory is certified with Good Manufacturing Practice. Our goal is to provide a total solution for nucleic acid detection, from sample preparation, then DNA RNA extraction, to the nucleic acid amplification and detection. For sample preparation, we have charcoal plate beating homogenizer to complete homogenization of animal and plant tissues. Then we provide a charcoal mini to extract nucleic acid automatically. And the Pocket system can do the IIPCR. In recent years, Pocket Central Nucleic Acid Analyzer combines extraction and the PCR to make these procedures more convenient. Our products reduce the complicated steps and shorten the operating time. Let the customers feel easy to perform. Besides the device, Gingrich have developed reagents of various diseases that could apply in different industries, including swine, poultry, ruminants. Also aquaculture, companion animals, and IVD. The PCR reagent contains the important pathogens for separate industries. This product was called PCR system. We use the technology for nucleic acid detection is insulated isothermal PCR. The abbreviation is IIPCR. It provides isothermal heating at the bottom of the capillary tubes to induce a natural thermal convection and the temperature gradient to drive the PCR reaction. This table shows the difference between traditional PCR, real-time PCR, and IIPCR. Conventional and real-time PCR take more time to create cycles of heating and cooling. IIPCR is generated from the temperature gradient, so the reaction will significantly reduce. And because there is only one heating point, we can make the PCR device to be lighter and portable. As the operating procedures, we use the universal program so that the personnel without specific training could easily operate these systems. Different from traditional lab, we provide a simpler, more convenient, as well as economical choice for customers to solve their problems. Our PCR system includes PCR Micro Combo and PCR Central. PCR Micro Combo contains Taco Mini and PCR Micro Duo. Taco Mini is the DNA-RNA extraction device based on the magnetic particle transfer technology. It could extract 1 to 8 samples per round and only takes 25 minutes. After nucleic acid extraction, PCR Micro Duo could be the character for PCR. With its lightweight and built-in rechargeable batteries, PCR Micro Duo can be a portable tool for customers to carry easily. It only needs 45 minutes to get results from maximum 4 samples per round. Another product in PCR system is PCR Central Nucleic Acid Analyzer. It integrates nucleic acid extraction and IIPCR in one machine. That means it is all-in-one machine. And the most important, it is a full automatic device so that can simplify the testing process, minimize human error to provide easy results at the point of need. And I think the operating procedure will surprise you, as it is quite simple for people without professional experience. Just choosing the reagents that you need, preparing the sample, no matter from an animal or from the environment, then transfer the sample into the cartridge and placing into the PCR Central. You will get the qualitative result in only 85 minutes. To give it a short summary, PCR system provides a simple, fast, and convenient platform for nucleic acid detection. As a result, we optimize our products to become user-friendly in designing progress. So even personnel without professional skills could handle this system. The advantage includes the operating is not limited by location. You can see our customers in these pictures. They create a portable lab in the farm or even on the car. It also saves plenty of time as you don't need to send samples to the outside lab anymore. Without the transportation time, our customer could get qualitative results immediately. According to this, they can react to the disease very quickly. Actually, Our system and the reagent have also been certified by OIE and authorities from several countries. Besides, FAO in Vietnam used this system to help control avian influenza. Then I want to discuss something interesting with you. Is PCR can only help doing diagnosis? We have some experience for different PCR application in animal health care. Aside from diagnosis, PCR could help evaluating the day-old chick quality, monitoring the biosecurity in the farm, as well as checking the vaccination uniformity. For diagnosis, we take the fall adenovirus for an example. Fall adenovirus belongs to adenovirus group 1. It is common in all commercial operations. Therefore, FADV is important to the poultry industry. Now we know FADV is classified into genotype A to E and serotype 1 to 11. It will cause disease such as inclusion body hepatitis IBH by serotype 2, 8A, 8B, and 11. The hydropericardian hepatitis syndrome caused by serotype 4 and adenoviral gizzard erosion by serotype 1. The birds frequently get infected with multiple serotypes and will lead to the economic loss. Adenovirus can transmit by direct or indirect contact, also by vertical routes, so it is not easy to block the transmission. We can see there are cases reported in many countries, including infection of IBH, HHS, or multi-infection with the both disease. Why is FADV important to the poultry industry? In a broiler farm, there is no significant clinical signs in early stage. When the virus titer gets higher in the flock, it will cause a sudden onset of mortality, especially approach to the harvest. So it will cause severe losses. And after outbreaks, the chicken's growth rate will get slow because the chickens may get diarrhea, lethargy, and losing appetite. It also induces higher feeding conversion rate. And the characteristic of FADV may lead to immunosuppression that will cause the vaccination failure. So these all will increase the implicit cost. GeneRich provides 3 kinds of FADV reagents to detect all types FADV and the different serotype like 4 or 8B. Therefore, in the rearing period, when seeing something wrong with the birds or they show the clinical signs, we suggest to collect samples from the sick birds, no matter the swabs, liver, or kidney. Then, in the first round, checking if they are infected by FADV. The positive result could lead to the second step, serotyping. As serotype 4 and 8B are common in the field, Pocket Central could be a better way to confirm the serotype and choose the corresponding vaccine in the farm. Then the second PCR application is animal quality control. As we know, Mycoplasma gallisepticum and Mycoplasma synoviae are really common bacterial infections that induce respiratory disease in poultry farms. Then we'll talk about the influence from the Mycoplasma. NGMS induces air circularitis. The fibrinous caseous lesions will cause poor carcass quality. And for the layers, the decreasing egg production, also the poor egg quality will cause huge economic loss. The way to control mycoplasmosis includes vaccination, medication, biosecurity, and animal quality control. So what is animal quality control? In general, customers used to give the medication treatment after finding clinical signs of NGMS. It might bring out some consequence. After treatment, sometimes the chickens will recover, but it needs a longer treatment time. And for another situation is the treatment is not giving in time, then the disease still outbreak. This is why we need PCR to control the day-old chicken quality and detect mycoplasma as early as we can. Detect the pathogen before presenting clinical signs so that our customers could quickly react to the disease and give proper treatment, like the medication flushing. In this form, for example, the day-old chick was detected mycoplasma positive in the first day. Then the veterinarian used medication flushing. After that, the vet or the owner also need to check if the therapy is efficient or not. So keep doing the PCR every week to see the negative results. If the therapy doesn't work, choose another medication or drugs. The method will help reducing the cost of medication and also prevent the poor carcass quality. To the poultry farm, we provide this PCR program for animal quality control. Once customers get the chicks from the supplier, randomly choose at least 10 chickens to collect the trachea swabs in every 50,000 chickens. 5 swabs can pour into one tube, so you don't need too much PCR cost for the reactions. And they use mycoplasma MGMS reagents by Pocket Central to get the PCR results. According to the results, consult your veterinarian for further treatment. We have done a field trial for day-old chicken quality control in Taiwan. In this trial, the day-old chicken batches were from 4 different suppliers, A, B, C, and D. And they were all collected the trachea swabs, then run the PCR to check mycoplasma, MGMS. In this table, we can see the result. Some day-old chicken was contaminated by MGMS before entering to the broiler farm. The positive chicken are not just from different suppliers. Even the same supplier, there are still different PCR results in separate batches. So according to the PCR data, the farm, our customer can give the treatment early. And they can also establish their database about the day-old chicken's quality in their farm. Now I would like to show you a case from our customer. This broiler farm in Southeast Asia is with 3 houses, 75,000 chickens from the same supplier. They had MGMS outbreak before, so they regularly give antibiotics at week 3 to prevent MGMS. Besides, there are some problems about IB, fowlpox, E. coli, NDIBD, but no routine tests were performed at this farm. We collect samples from the environment and also day-old chicken. In this table, we can see, before introducing the chicks, the PCR result of environment show all MGMS negative. When the chicken arrive at the farm, they sample the trachea swabs of day-old chicken immediately and run the PCR to check NGMS at the same day. The day-old chicken are all contaminated by the NGMS before entering to the farm, and our customer is really surprised at this result. So they use the antibiotic to flush NGMS from day 1 to day 3. Then check the NGMS weekly until they are all negative. From this case, we can know that the early detection can lead to early treatment and save our medication cost. In this trial, we know that animal quality control could really help the correct and the smart use of antibiotics. When we know there are infection happen, quickly treatment can reduce the cost of the drugs, also prevent the poor meat quality. And now we will talk about the third application is biosecurity monitoring. Everyone knows we should do the good biosecurity in the farm. Clean the dorms, disinfect the vehicles and the shoes for the purpose to prevent the contagious disease. But seldom people use a tool to make sure the efficacy of cleaning and disinfection. There might be virus or bacteria inside and outside the farm, and it's hard to find out until the birds are getting sick. So the experts told us doing the cleaning and disinfection for the equipment, houses, hatchery room, as well as the vehicles that come from other places. But there is no suitable tool for checking the efficacy after cleaning and disinfection. In the past, it is difficult for the farmers to do PCR in the farm. Now, we have pocket system just using the swabs to collect sample from the above items after disinfection. Then we can pull 5 swabs from the same house or the same vehicles into one tube. The buffer here could be PBS or a sample storage solution from GenRich. Please note that if you want to test Salmonella, the sample should be pre-enrichment with BPW in 37 degrees Celsius for about 18 hours. And choose the corresponding reagents for detection. The result will show on monitor. And according to the results, our customers could know if they need to check the protocols and or choose an efficient disinfectant. Here is a field trial in Taiwan. This farm had collected samples from drinkers, feed tray, and fan before clean and disinfection. The results show there were several samples from the equipment are positive, but after their cleaning and the disinfection procedures, the test results show all negative, which means they used the correct way for cleaning the environment. In the last part, we want to introduce the application for vaccination improvement. PCR could be applied to check the vaccination uniformity. And then I will take IB, infectious bronchitis, for an example, because IB is one of the most important diseases in the poultry farm. IBV produces severe respiratory syndrome of all age chickens. With gasping, coughing, sneezing, sometimes you will hear the tracheal rails or see the nasal exudate and the wet eyes. Some IB virus strains induce the nephritis syndrome, which is characterized by increased water consumption, diarrhea, and the excretion of large amount of urate through the feces. After necropsy, the kidney show enlargement and urine deposition. As for the layers, they usually present with reproductive tract and show a decline or cessation in the egg production by as much as 70%. When laying resumes, many eggs are abnormal, including thin, soft, wrinkled, rough, and the lack of the calcified shells. The eggs that should be colored are often pale or white, and egg albumin may be watery. In common way, the veterinarian will diagnose the disease according to the clinical signs, lesions, also laboratory methods like ELISA, HI testing, virus detection, PCR, and sequencing. We talk much about the IB influence, so how should we prevent and control IB? There are 3 different directions we should follow. Although antimicrobial therapy may reduce the mortality caused by bacterial infections, no medication alters the course of IBV infection. So manage the farm includes keeping the environment temperature, balanced nutritional of the diet, and providing electrolytes in drinking water may assist in outbreaks caused by IBV. And number 2, make sure doing correct biosecurity to stop virus come into and spread in the farm. Number 3, every farm should discuss with your vet and set up a suitable vaccination program for your farm. But even we use IB vaccine to prevent the disease, why IB is still outbreak sometimes after vaccination? There is a phenomenon that may caused by IB vaccine or live IBV. IBV will make cilia in the trachea become ciliostasis, which means it will temporarily affect the ability of defensive mechanism. The pathogens cannot be removed by the cilia in the time. It's like the door opened and the pathogen will invest to trachea, cause the infection and disease. As a result, the better way to lower this risk is to let the flocks have ciliostasis at the same time. The door open period will be shorter. We call it vaccination uniformity. Poor vaccination uniformity may increase the risk of pathogen invasion. It was thought to be one of the reasons that IB is still a sporadic outbreak, although we use the vaccine to control. We can see these pictures. In the hatchery room, the day-old chicks were spraying with IB vaccine. How could we know every chickens are well vaccinated? How could we know the uniformity of vaccination? Some farmers usually evaluate vaccination efficiency by the dye on the chicks. You can see here are green dye on the chickens. But actually, it's not really a good way to judge the efficacy only by our eyes. Besides, some farmers use ELISA to evaluate the efficacy after vaccination. In this figure, this is the ELISA titer from day-old chicken to day 28. In the initial 2 weeks, the titer is caused by maternal antibody, which means they are passive immune from the hens. It will gradually decrease from day 0 to day 14. And the antibody induced by IB vaccine is usually get higher after 4 weeks. So if we want to know the vaccination efficacy in 1 month for the broilers, ELISA may be not a proper tool for evaluation. If ELISA is not an appropriate method for evaluating vaccination uniformity, what should we do? Now I would like to share a new idea for you. PCR could be a suitable tool for evaluating the vaccination uniformity. According to the IBV infection pathway, when we give chickens the live vaccines, the attenuated virus will enter to the respiratory tract and replicate in trachea to induce the protective immunity. Because the vaccine virus can live and replicate in chicken's trachea, we should collect the trachea swabs randomly and individually from the chickens. And the collection time is after 7 days post-vaccination. The sample number could depend on the flux amount. In our suggestion and in our experience, randomly choose 10 chickens for collecting trachea swabs in every 50,000 chickens. If the farm has less than 50,000 chickens, it is still necessary to collect at least 10 samples because it is a better better number of the samples to calculate the positive rate. After collecting samples, we could use PCR technology to make sure the virus existence in the trachea or not, and the chicks were well vaccinated or not. If the positive rate is higher than 80%, that means the IBV vaccination uniformity is good. But if positive rate is lower than 80%, we will suggest our customer to check the vaccination procedures and improve the procedures in the next batch of the day-old chickens. We can take this trial in Taiwan for example. In this farm, the farmer really cares about the IB disease because the farm had suffered from IB and caused huge losses. After they did this test, the result in this picture show that the PCR positive rate reached 90% on the day 7. That means these chickens had good vaccination uniformity. In another case, we compare chickens from different suppliers. The results show different positive rate. You can see in this picture, the PS Farm B and the PS Farm C had a lower positive rate than PS Farm A. They might be generated by the inappropriate vaccination procedures. So the improved action should be taken for a better efficacy. And after our customer reflect the problems to the suppliers, the later batches chicken show better uniformity in the IB vaccination. Of course, in addition to IBV, we also provide various kinds of reagents that can be applied in poultry vaccination uniformity check. NDV, MGMS, ILT. The sample types are all trachea swabs. As for the varicose disease virus and the HVT vector vaccine, the required sample is feather pop. They are not too difficult to collect, and the advantage for checking the uniformity is that we could do early response to the poor result. This concept could be applied to disease that with the live or HVT vector vaccines. For today's presentation, here is some messages for you. We know that GeneRich provides a total solution for nucleic acid detection. So we have the pocket system that is not limited by personnel, the locations, and time. And the pocket system can be applied in various industries, like we talk about the application in poultry farm today. They can also be used in the swine farm, in the animal hospital, or for aquaculture. Because the simple and the portable characteristics, the pocket system can do more than diagnosis compared to the traditional PCR. It will help the companies or the farmers to manage their animals' health. Okay, it is my presentations today. I hope the presentation can give you or provides you some new concept of our new ideas in the animal health management. And if you have another new ideas, please share with me. I would like to know more about the PCR application in the farm. And I put my email on the slides, so you can send the email to me. Or if you are interested in our pocket system, in our products, please contact with our sales manager, Erin, and I also put her email on the slides. Thank you so much.
Okay, thank you for Susan's excellent presentation. So for now, I think you can know the PCR is not only for a diagnosis tool, but also can be a health management tool in the poultry farm. So now, if you have any questions, please feel free to leave the message on the message board for us. So now welcome, we are going to the next section. So welcome Dr. Fu to the presentation. So hi, Dr. Fu, if you welcome to say hello to our audience.
Hi, everybody. Welcome to this webinar, and I hope you will enjoy the contents and the presentations of the whole sessions. Okay, see you.
Thank you, Dr. Fu. Okay, so now we're going to have Dr. Fu's presentation. Thank you.
Good morning, good afternoon, and good evening. First of all, I'd like to thank Ginrich for inviting me to this very beautiful webinar, and I wish to share some of my experience and my thoughts about how we able to win over poultry health management by thinking out of the box. Just now, I think you had listened to our presenter, Susan, who presented few very important strategy on how to diagnose and also monitor the poultry health. And I think it's a very important message to be sent in this meeting that we need to really do something very different. And I'm going to summarize some of what Susan had presented into a table. We all know nowadays we are constantly under very strong challenge of diseases, and our poultry industry is still heading very severe headwind of diseases. For example, avian influenza. Those could be considered as infectious diseases, and some of the diseases could be classified as horizontal and vertical transmissible, which continue haunting the industry. Not forgetting, some diseases never emerge in certain continents or islands, has become a new threat that we could be underdiagnosed such a situation. So what can we do in this year 2023 with the technology, with the knowledge? How are we going to win over the health management? So this could be discussed in this meeting, and some of the unforeseen diseases have been also discussed by utilizing the technologies on-site PCRs to diagnose. So let's see what we can look at some other diseases as mentioned below. We do not need to really discuss in detail what's going on in the world, especially with the avian influenza, because we have enough cases that in the last 6 months to 10 or maybe a year that we have been overwhelmed by the cases, reported over the places you can see at the red dots on the map. And one thing I really kind of worried is on your left you can see our Brazil is still trying to hold as the last piece of clean land, but the other part of the South Americas are almost being smeared with red, and we couldn't have much chances to win over, except considering something we never do it before. For example, vaccinations, for example, active surveillance, for example, more strengthens in terms of biosecurities, up to a level that we almost thinking, should we deploy more on-site testings like what FAO have been doing in the last few years, and also should we put more interventions of farming's kind of biosecurity enhancement, for example, filtering certain inlets of air inlets to minimize kind of airborne or also vermins that could be entering the farm. So we need to think about that. Looking into the helpless chickens or wild animals that have been seriously affected by the avian influenzas, should we also think about what we have learned from COVID episodes to help the animals or to help the industry to reduce the problem, or at least to maintain the supply or the flock's survival rate to get over this year 2023. Not forgetting, diseases are not always contagious. It could be from management, it could be from nutritional, it could be from any wrongdoing, or even management issues that induce certain condition called metabolic disorder. So what can we do to kind of mitigate or also anticipate the problems or diagnose a problem? So we seriously not using any conventional method yet, or some conventional method have been determined but never been widely been used, or baseline establishment, something like that. So should we start to do something to work on metabolic diseases as well? So this is also some of the reminder that in this meeting we are not only looking into infectious diseases, we're also looking into non-infectious diseases. Every time when I go to the farm, I always think, how do I able to control, diagnose, and also predict the outcome of a disease, and also to help the industry or the farmers or even my companies to experience the least losses caused by diseases, and also how are we going to be more in control. I learned some warfare strategy. I believe that some of the strategy may help me to be applied in terms of getting some philosophy that is useful to be deployed into my study or my work. And I always think that we need to digest all the strategies and also understanding the current field situation. Okay, both nutrients need to be digested and transformed into some message that go into our brains to be processed and come up with a solution. So I always read through number strategy from 1 to 36, and I always think over and over that there could be more strategy than 36. Maybe there are 37, meaning that if you cannot fight your enemy, run away is also a strategy. So I see also I experienced some near outbreak of diseases in my neighboring country, even in my countries, that the farmers have been neglecting the science of biosecurity, not getting enough downtime, and place chickens in farms that is near to a outbreak ground zero is absolutely suicidal. So that kind of situations really taught that we need to have strategy, we need to have some philosophy that is supporting our strategies, so that our tactics that we've been used, like what Susan had mentioned, what kind of tactics that you can use in your practice are all based on your strategy. Okay, so it could be more importantly understanding the strategy correct, or get the strategy correct, rather than straight go to the strategies or the tactics that you thought is correct. Our first strategy or tactics, we need to think like a virus. We as doctors, or maybe as farm manager, need to shift the paradigm to think, if you are a virus, how you're going to enter the farm and cause a disease. So those are the paradigm shift that will help you to try to review what you have planned, what you have laid out, your farm, your biosecurity, your chicken. What are the weaknesses and what are the strengths? So you may try to put your biosecurity conceptually correct, structural correct, or operational correct from your perspective. Okay, so is it correct according to the virus, which is not getting all the proper training? A virus or a disease or a bacteria, okay, or vermins, they will just follow the nature, okay, they will follow the law of gravity. So they will try to go into the site that is the weakest point or least control. So if you think like a bacteria, you think like a virus, more or less you may be very differently design your biosecurity, re-look your biosecurity, even challenge your current biosecurity to see whether is able to work under your control according to your expectation. For example, post-cleaning and disinfection. How do you know that all the virus and bacteria being properly cleaned? How do you know that all the bacteria and viruses are not getting into your farm every day? Biosecurity is every day, okay, 24 hours, 7 days a week. So how are you going to challenge it? What kind of tools? Okay, so you think you are a virus and you try to survive through, and probably you can work out a solution for it. So looking into the chickens, our chickens are taking into the farm, we probably have very so-called confident biosecurity level. What happens if the chicks are a Trojan? Okay, they are carry something you don't know and you never want to know, and how are we going to discover this is a Trojan. Okay, how are you going to know that some parasites or some kind of vermins that carry certain pathogens that you don't want? Okay, so you need technology to help you to investigate. I also think that in the last 6 to 9 months, I have been working with some poultry practitioners and found out that the infrastructures and the hardware of the inputs of getting biosecurity strong is inevitable. Compared to chemical control, compared to biological control, compared to other means of control, we really nowadays need to look into physical control where the chickens are physically, okay, with very strong and also concrete kind of material to keep away the your frogs, which is considered clean after testing, to the outside vermins or any contaminants that is very difficult to control if you don't have a strong concrete structure. So this is a corridor that we connect the post showers into the chicken house without recontaminate from the walkway, which is uncovered or mud. This corridor is fully covered with disinfections device, and we found the mycoplasma and salmonella occurrence is controlled tremendously in the way of compared to without any device like that. Whole health management, of course, when I mention to most practitioners, they all understand this. Okay, we need to enhance the biosecurity, husbandry, environment, nutrition, and definitely we need to minimize the stress, any form of stress, okay, either from poor ventilations or any forms of stress that induced by the management, poor feed distribution, high stocking density, all sort of things. Minimize the vermins and pathogens, that your health management could be partially success, not fully, because how are you going to measure? How are you going to control the situation before the situation control you? Well, I just put in a summary my wish list, okay? A working or my wish biosecurity philosophy must be pragmatic, okay, must be proactive, must be able to manage risk, okay, and also innovative. Those are my 4 pillars of philosophy of disease control. We cannot use an old kind of a program and follow it and never question about it. So a dogmatic kind of program should be done, or maybe should be revised, so that in this future, or also like what's going on nowadays, we need to fight the disease, okay, of what is going on now, which is not the disease of in the history. However, talking about those diseases about 100 years ago, like Newcastle's, like bronchitis, they're still able to break the biosecurities, or biosecurity breaks allowed them to cause problem in our industry, even like avian influenza. It's because we had increased much of the poultry stocking density of populations, but we never think out of the box how to be more proactively monitoring a situation. Okay, so we need to rewrite the control. We need to make the control or maybe a program more proactively looking for a disease rather than waiting a disease to happen and we try to diagnose it. So proactive is we try to look for it. Okay, so this is the way, is a different way, is instead of turning left we turn right. So using all the innovative gadgets or also diagnostic tools, we want to win against the time, we want to win against the accuracy, sensitivity, to be more in control. Waiting a disease to happen is not a control, it's just a reactive kind of measure. And also looking into all sort of work, okay, that we have gathered, we had kind of practicing, we need to come up with a trend or kind of interpretations whether are we heading a better control or we are heading out of control, okay, meaning that we are losing control or we are having problem, and what kind of normal in certain situations as what we are experiencing now, so-called normal inverted comma, is what are our baseline where we want to march towards certain baseline that is our wish list, okay, which baseline. So those things could be more defined if we have a system to analyze it. We know how to put it into a dashboard. I know nowadays you can utilize Excel or Google Studio, data management, that kind of software to do it. You need to do that because you can never monitor a point, another point, but not connecting all the points to see a trend. Just look into poultry health management. For example, in most company, you probably have a routine program. Yeah, you monitor all these different health situations, even the productions, or even the quality of the checks, or maybe the customer complaint, etc., etc. All this routine program, okay, probably stated here some of the examples that our interest of monitoring. And not forgetting, we are also medicating and also vaccinating the frogs. Okay, this is not over. If all this management have been documented and put into the data bank, it has carried no meaning. It should be rewrite into a proactive program that, for example, if there is a suspect of something, despite follow the dogmatic program, you can always break the program and test, okay? And then in case you may have the frog entering a raining season, for example, or maybe you're changing vaccine, for example, or you are changing the medications, or you are pulling out all the medication, for example, your ad hoc testing and also your new revised program will be very different. And not forgetting, after all this medication, demedications, vaccinations, increase of frequency or reduce of frequency, all this need to be audited, analyzed, and managed in the data for creating a trend or something that you're able to predict what will be the outcome. I just briefly to summarize what Susan has discussed just now. She touched about a few areas, for example, monitoring the environment, monitoring the post-vaccinations, day-old chicks' health, and also post-medications. Here, I wanted to add on two things. One is worming. And people may ask me, why you test the worming if there's a dead rat or dead bird? What disease you want to check? This is not our chicken. Yes, this is not our chicken, but it will carry diseases. And I assume if there is a dead rat or dead birds found in our farm, found in our chicken house, we need to run a PCR test. Okay, and also if I'm an integrator, okay, I want to know in general what has been gone wrong or going on with our situations in the field. This is what I learned from the COVID episode. We can actually check the sewage water or the suspect chickens for a disease. Okay, so proactive is much important than a reactive control strategy that I try to summarize what Susan had presented, and also what is my wish list on looking on diseases, and also try to utilize data, okay, or observations that you put in to make it a alarming message. Okay, so in case in the necropsy postmortem you always find disease or condition of this, for example, all the time, or maybe always in the in farm A compared to farm B, then we need to kind of strategize a task force or something to work on these issues. Nowadays, 1% carry plenty of costing and money. So with plotting out a mortality survey data, we're able to prioritize which is to be kind of anticipate and also resolve, which is least. Okay, so this is very important. So some of my customers starting to look into these measures, but I have some customers have been practicing this data collection since 6 years ago, 7 years ago. So it's never be too late to start working on getting all the data and also translate it into a more useful message. For example, in X year, Y year, okay, and you have changed your vaccinations, you have changed your medications, you see your mortalities is going up or going down, that could carry some meaningful stirring of your management and to kind of conclude whether you have successfully resolved a problem or the problem is worsening. For example, this coccidiosis is kind of looking a little bit difficult to be controlled. So, however, the egg yolk peritonitis looks a little bit promising, and also asaccharitis looks a little bit on the down trend. All these could be very useful if you have the data and able to analyze it in a way. So what is important? What is least important? If you try to think from details, okay, attention to the details, devil's always hiding in the details, you could able to make the management of the health become a success. If you lose all these details, you could make the whole program in a failure. So sometimes you should really invert the whole program and start looking into the details by a team of people or even outsider Sometimes you cannot see your own problem, but the outsider can. The whole idea that what I try to discuss, okay, the cost of running it is way cheaper or lesser than a real disease happening. For example, the biosecurity cost actually is just like, 10 cents per broiler per rearing day, 20 cents to 30 cents per breeder per rearing day. Those are no money compared to a real avian influenza outbreak that I'm going to show you later on. Okay, monitoring costs. Okay, for example, you do a PCR, you do a ELISA test, you do any bacteriology test. It's not really that much. Okay, compared to the breeder, yes, you need a little bit more, but some breeders are grandparents, some breeders are even higher generations, even parent stock. You still need to monitor your cost in a way that it represents the whole farm. Okay. Looking into the vaccinations nowadays, vaccine is not cheap, but they are very good. They are very effective. They are very efficient. But you need to monitor whether the vaccine have been successfully been inoculated into the chickens or not. Okay, so those are very important. Medication costs only for the chickens that is needed, but still nothing is cheap. How are you going to know that the medication is working or not? You need to monitor. And here I never put on the costing of how much you will monitor for metabolic diseases because I'm still in the process of working on how to quantify and also determine a good baseline for the metabolic disorders or normal serum biochemistry profile, for example. Yes, the disease cost is always very, very high and disastrous. So even slow spreading diseases, least acute diseases, they are still very, very expensive. So be aware that this so-called disease is always very costly. Recently, I tried to play a little bit with some artificial intelligence, hoping that it will help to enhance our diagnosis, our work, and also to understand the disease more. But don't forget, artificial intelligence learn from us. We are the real intelligence, and with our experience, we teach or we give lessons to artificial intelligence. So it still take away maybe like a couple of years to get this technology stabilized, but thanks some social media, we're able to diagnose or so-called discuss some diseases over a chat group and get some clue what is going on. And not forgetting that disease is always ahead of us, so we need to be more proactively able to diagnose and also get involved of what is going on in the farms and gather all the so-called intelligent input into discussions to help into some so-called solution. With that, thank you very much, and I'd like to entertain some questions if there is any, and thanks for listening. Thank you very much.